he's been getting it from back home. So newspapers are just, I mean, they're just destroying him at home in the news. His constituents are, and I believe Jason is going to fold. And he is going to do what the Senator's doing and have an investigation. He has to. I don't see how he can't do it and know that when he goes home next year, he has to do it. Good morning.
My name is Tracy Mitchell. I am a member of the Warrensville Heights Community.
She's got a soft voice.
I'm a member of the Warrensville Heights Community. I'm also a member of the school board. I am a product of the school system, and I wanted to come this afternoon to ask questions and ask for your support and how best we can position ourselves as school board members. My counterpart Pamela actually asked the questions I was going to ask. So I wanted to come in today just to say we do need you. We need our state legislatures as well. We are fighting a battle in the public school system with our charter schools. They are taking money from our students, and we really need the support from both the state and federal level to assist us in our endeavor as we work diligently to rebuild the public education system.
The next big break we get is like around Easter. So I'm going to try to schedule a meeting with school boards around that time, around that Easter break time. So we're going to start working on it. And since you and, where's your colleague? Okay, so I'm going to put you on the committee. So help me set it up, okay? All right. Thank you very much. Yeah.
Okay, it's kind of along the same question Deborah asked. In the Washington Post yesterday, it was reported that we know a couple days ago Rice Krieman's was in the news for talking to the AG, the Department of Justice, and the FBI about the Russia connection. It was reported in the Washington Post yesterday that the head of the House committee, who I believe is Representative News from California, and the head of the Senate Intelligence Committee, who is Richard Burr from North Carolina, that they have been speaking at the request of the White House to try to tone down the press about the connection. Right. So as citizens, yes, I contact Rob Portman all the time. It's a waste, but I do it. Who do we contact? Do we go after the head of those two committees? Do we go after the Attorney General? Because he's not unbiased about this. Who do we contact?
First off, it's never a waste. It really isn't. Every single person that contacts our office, we think at least 50 people think that same way. So it's never a waste, because at some point, if enough people do it, they know there's a problem. But I think you do. I think you contact the head of the Intelligence Committee, both House and Senate. Because I think that the more they hear from people, and you know what, you always have to call. This is something that I recommend you do. If you have 20 or 30 people, have them all do it the same time, the same day. Because what you do is you almost shut down this system. If everybody does it the same time, same day, and they're like, what in the world is going on? It just freaks them out. So I think it's something, but it makes a difference. We really do listen when people contact us. Now, they may be stuck in cement and won't move at the time, but we hear it, and at some point we will respond to it.
Congressman Doug Tayak from Shaker Heights. I want to reiterate what the educators said before about your staff. I think in all of my dealings with them, they are a great reflection of you and your dedication to your district, and they're professional and very talented.
Thank you.
But you deserve a raise. So lost in the discussion on healthcare reform and Medicare and Medicaid is that House Resolution 708, the State Age Range Flexibility Act, was introduced in the House about a month ago. The resolution would amend the Public Health Services Act, which would change the law regulating insurance companies' ability to charge older adults higher premiums than their younger consumers. This bill would allow insurance companies to charge older adults up to 500% more than their younger customers pay in premiums. It would also allow states to charge or change the ratio for state-managed healthcare plans to a ratio that the legislature deems affordable and responsible. Can you discuss your position on age rating and how you plan to vote on HR 708?
Well, I'm not a big fan of age rating, but let me just suggest this to you. I would need to look at the bill, but I am not a big fan of it, because what happens is, it's so different than with Social Security. Younger people pay into the system to assist the people who have worked for a very long time. If we age rated, we allow them to increase by 500% or 400%, whatever the amount would be, we would have seniors that would be so sick that first off, it would cost more in emergency room visits and doctor's visits. The cost would be astronomical if we did that. That's number one. And number two, when did we become a country that doesn't take care of its poor? That is sick, it's elderly? I mean, who are we to say that we don't want to take care of our elderly? I just think it's a sad, sad thing that we would even think about some of these things. That's my position on it. You know, I saw some other people trying to ask questions. My staff, I'm going to have them all come over here. So if you got something really pressing, after this, my staff will be here. You can ask them whatever you want. But I saw two people. I'm going to let them in, Bill. I saw two people. You right here, and there was one other person that tried to get up. One other person. I said, no. It was one other person that actually came to the line. That actually came into the line. It was a woman.
There were a lot of them.
Oh, there were a lot. Oh, okay, so they stopped you a long time ago. Okay, then we're not going to do, okay. Don't let me mess it up. See, that's what happens when I do something I do.
Thank you. My name is Lauren Kodum. I live in Cleveland's Cadell neighborhood, and I'm a grassroots manager at the American Cancer Society's Cancer Action Network. I represent the thousands of volunteers who've come forward with their stories about Medicaid expansion saving their lives, and being able to get insurance because of the being able to save their parents' insurance. And those who were with us in Toledo outside Senator Portman's office on Tuesday, and will be with us today at 2 o'clock outside his office too. But for cancer patients and survivors, they need that coverage that's available. To people with pre-existing conditions, adequate to cover their treatment and follow-up care that's affordable. And I know that there was legislation introduced in the House, the Walden bill, that kind of covers all of those patient access, but it doesn't have care that's adequate and affordable for cancer patients. Doesn't give them the vehicle for those patient protections. So will you oppose any bill that does not keep the patient protections and ensures that coverage is adequate and available for cancer patients and everybody?
Absolutely. Absolutely. Now, since I'm feeling bad, how many people try to get in the line? Well, that's a lot. How many is it? The hands that are up right this second, come to the line. No other hands. Some hands I didn't see. There were some hands I didn't see when I said come to the line. But this is what I'm going to ask you to do. I'm going to ask you to